A very good morning, students. This short video is meant for the newly admitted student who have already got the admission in the medical colleges in first MBBS, or those students who are waiting for their admissions. Okay, this is just an introductory, the first video for these students. Okay, now this is just will deal with the question how you should begin the study of human anatomy. Most of the students must be apprehensive that how the subject of anatomy should be studied, how we will study it, as they must have heard that this is a difficult subject. So in this short video, I will tell you that how you should begin your study of the human anatomy. Now, let's come first to the definition of the human anatomy. What is human anatomy and what we learn in the subject of the human anatomy in the first year of the medical school? It is the study of the structure of human body. So the human anatomy is defined as the study of the structures of the human body. It may be an external structure or an internal visceral structure. Okay, this is the study of the structures of human body. It may be a blood vessels, it may be nerve, it may be organ, it may be skin. Okay, anything. Any structure of the human body is the anatomy, the human anatomy. And I have extended this definition by also studying the relationship among the structures. That means it is not enough just to study the structure of a particular organ. For example, if you are studying the kidney, it is not enough to study the structure of kidney itself. In the human anatomy, medical science, you will have to study what are the other structures which are in front of it or in the back side of it or by the side, superior or inferior. That means you will have to study the relationship of other structures with that of a particular organ, and that makes the subject of anatomy little difficult to understand. Now, as you must be knowing that in the first MBBS or your first year of the medical study, you will study three broad subjects: anatomy, physiology, and biochemistry. But in this video, I will talk only about the anatomy. Then the question comes, what are the different subjects or books which you will have to study for the human anatomy? Okay, you will have to study many books in the human anatomy. For example, you will have to study the general anatomy. See the pointers. I am moving the pointers on general anatomy. You will have to study the gross anatomy. Now the question will come, okay, since you are very new, what is gross anatomy? Gross anatomy means the anatomy or the structure of human body which you can learn with the help of your naked eye. That means without the help of any microscope. Okay. So when you dissect the human body, you study the structure of organs, you study the structure of bones, you study the structure of the blood vessels and the nerves. All this comes under the subject of the gross anatomy. And the gross anatomy is the major part of the human anatomy in the MBBS course. Around 70% of your anatomy will consist of the gross anatomy. Okay. So this is the structure which you learn, I mean say structure of human body which you will mainly learn by the lectures and dissection of the human body. Then the other subjects will be histology, where you will learn the structure of the body with the help of the microscope. You will learn the embryology, where you will learn the development of the embryo and fetus in the womb of the mother right from the fertilization till the birth. And then lastly, you will also learn in anatomy the genetics. And why genetics is in anatomy? The reason is that you have to learn the structure in the anatomy. As per definition, it is the study of the structure, and the chromosomes are also the structures which are present in the nucleus. So that's why the genetics is also included in the anatomy. Then I am passing to the next slide. Then, which is the first book to be studied in anatomy? As this is very first video for newly admitted student, the question must be coming in your mind, which book you should study first in the human anatomy. The name of this book is the General Anatomy, and General Anatomy is a very small book, around 130 or 50 pages. Okay, and this has to be studied in first 15 days soon after your admission. Then the question must be arising in your mind, what is general anatomy and what is there in the book, okay, which we have to learn in the first 15 days. General anatomy is an introductory book, okay. It is an introductory subject which is taught to the newly admitted student in about 10 lectures, and sometimes it may be more than 10 lectures. And these lectures are taken 10 to 15 lectures at the most. They are taken before the student actually start learning the anatomy proper. That means the gross anatomy. Before they start learning the gross anatomy, and before they go to the dissection hall for the dissection of the human body, they should learn this general anatomy properly, okay, very well. Otherwise it will not be possible for them to understand the gross anatomy subject, which is the major part of the human anatomy. Now, why general anatomy should be studied first? Okay. Now, the reason, as I already mentioned, that without understanding the general aspect of the anatomy, that is general anatomy, students will not be able to understand the subject of the gross anatomy or the proper anatomy which they are going to learn in the department of anatomy. So these are the introductory lectures which is preparing a medical student for the study of the subject of anatomy proper. And without understanding the general anatomy, it is impossible to learn the subject of anatomy. Hence, in the first 15 days, students are prepared, okay, they are trained how to study the human anatomy, and that is included in the general anatomy. I hope that you must have understood. Now, this is a book on general anatomy. So the first book which you will which you will learn will be that of the general anatomy. This is the general anatomy published by PP Publisher, and this is written by me. I don't want to say that you purchase this book, though it is the easiest and the best available book. Okay, you can purchase any book for the general anatomy, and this book consists of many chapters. Now, these are the chapters which are there in the general anatomy, and these topics you will have to learn in the first 15 days of your admission. It is having the first chapter as the introduction of human anatomy, just the general things are there. The second chapter, that is the basic anatomical terminology. This is very important. This is a vocabulary to learn for a new kind of the language, and this language is the anatomical or medical language, okay, which you will learn. You will use some terms or some words which are not used by general uh, people, okay. This is used by the medical persons only, and this chapter will train you how to learn this terminology or the terms or words which are used in the medical language, okay. Then the chapter will come on the skin and its accessory structure. So we will learn first of all the skin, because when you will start your dissection, first of all you will cut the skin, and you should know all the general aspect about the skin, including its accessory structure like the hairs, nails, and many other glands like the sweat glands, the mammary glands, which is present in the breast. Okay, then the next chapter will deal with the superficial and deep fascia, and it is the fibrofatty tissue which is present beneath the skin, because this will be the second tissue or the structure which you will encounter while dissection. Okay, then you will be taught the skeletal system, the bones, general structures of the bone, classification of the bone, what are the different types of bones present in our body, its structure, histological structure. That means the general aspect of all the bones of the body will be taught in this topic. Then you will learn about the joints, because the bones, they join each other at the, I mean say they meet each other at the joints and form the joint. And you will learn about the classification of joints which are found in the human body, about the different types of movements which are possible at joints, whether the movement is free or it movement is restricted movement. So many general aspects about the joints, the structure of the joints you will learn in this chapter. Then muscles, similarly the general aspect about the various muscle, say for example skeletal muscle, cardiac muscle, or the smooth visceral muscles, you will learn in this subject. Similarly, you will also learn in the next topic about the blood vessels, that means the structure of artery, the structure of veins and the capillaries, okay, how the transport takes place of the nutrients and the gas through this blood vascular system, right? Then you will learn an important topic on the lymphatic system, which how the lymph is produced, how it is carried, how it is filtered in the body through the lymph nodes, and how the cancer is spread through these lymphatics, okay, or the lymph vessels. Then lastly, you will also learn about the nervous system, where you will just get a general introduction about the brain and spinal cord and the peripheral nerves coming out from the brain, the cranial nerves and that of the spinal nerves. Okay, you will also learn many things about the nerves, that how the nerves they will go and supply to that of the skeletal muscles, what are the receptors, okay, which are present, sensory receptors in the skin. So these are the topics which will tell you the general aspect of the anatomy of the human body, because this is necessary, because when you will actually start learning the human anatomy, it will be by region by region. First you may learn the upper limb, then you will go to the lower limb, like that abdomen or thorax or head and neck and brain, where you will only learn the structure of that area. Nobody at that time will tell you what are the bones, how, what are the different types of bone, different types of muscles, okay, like that, or the joints structure, nobody tell you at that time. The general aspect you have, because you have already learned that in general anatomy. So what I want to say, that general anatomy, which is taught as soon after your admission, is very very important. Don't miss any lecture in the first 15 days, okay, because this is going to form your foundation of the anatomy learning, or the base of your anatomy learning. And in the last, I will thank you for watching this video and wish you all very best for your study in the human anatomy.